So good afternoon, everyone. My name is Malcolm Campbell, and I have the pleasure and privilege of serving as the Vice President Research at the University of Guelph. And we're delighted to be organizing this particular panel session today on One Health. And of course, it is a pre-conference panel for this year's Canadian Science Policy Conference 2022, soon to be held in person, but this, of course, is a virtual session that we are welcoming people to in advance of the conference. So welcome, and thank you for joining us today. I've got a fabulous panel that I will introduce shortly, but before I do, I just want to remind everyone that those of us here in Canada live, of course, on traditional Indigenous territories. It's no different here at the University of Guelph. We're on the traditional territory and the treaty territory of the Mississaugas of the Credit, longstanding territory of the Haudenosaunee and Anishinaabe people, and now home to many First Nations, Inuit, and Métis individuals. We remember the ties to this land, the long-standing ties of our Indigenous people, and those of us who are settlers to this country, our relationship with that land that has been the home of First Nations people for millennia. We remember this as part of the process of truth and reconciliation, reminding ourselves of the long-standing ties of the Indigenous peoples to this nation, the challenges and indeed the atrocities that they've had to face over the time that settlers have arrived here in the country as a means by which to rebuild relationships, to reestablish trust through the process of truth and reconciliation. And I'd ask at this moment for all of you to reflect on the Indigenous territory in which you find yourselves and how you are working individually and together with communities to rebuild relationships with our Indigenous people. Speaking of relationships, One Health is truly a relationship of a multiple of disciplines. And how better to explore One Health and the One Health concept than to have a fantastic variety of panelists to help us consider the topic of One Health, the challenges, the opportunities, and the way that we can seize those opportunities in the future and use the One Health approach to navigate health challenges that we will be confronted with in the future. And I have just such a panel here with us today, and it gives me great delight to welcome, and I'm gonna give their names right now and their affiliations, and I'll do a better introduction of them or a little longer introduction of them when they each take the virtual stage. I'll introduce them now in the order that they're going to appear to you this afternoon. Our first panelist this afternoon will be Michelle Anholt from University of Calgary. She will be joined by Jane Parmley from right here at the University of Guelph, followed by Hélène Carabin, who is at Université de Montréal. And then we will be joined by Jack Vinder Danda with the Canadian Food Inspection Agency. And then last but not least, we'll be joined by Aaron J. Banerjee at the University of Saskatchewan. Wonderful panelists today, great ideas that they're going to be sharing with you. But before we do that, we wanted to set the stage a little bit and just share with you the concept of One Health and what it is that we're bringing to the table today for discussion, for consideration. The World Health Organization has a fantastic definition for One Health. And they define One Health as an integrated, unifying approach to balance and optimize the health of people, non-human animals, and the environment. It's a particularly important approach to prevent, predict, detect, and respond to global health threats, such as the pandemic that we've been confronted with over the course of the last 32 months. What better concept to bring to the table than a unifying concept to help grapple with a zoonotic disease like COVID-19, like SARS-CoV-2. The approach of One Health mobilizes multiple sectors, disciplines, and communities at varying levels, and we'll see that today, at varying levels of society to work together. So it is truly an integrative approach. This way, new and better ideas are developed that address root causes and create long-term sustainable solutions. And we'll be discussing some of those. So One Health involves public health, veterinary, public health and environmental sectors, and the One Health approach is particularly relevant for food and water safety, nutrition, the control of zoonotic diseases, the diseases that spread from non-human animals to humans, flu, rabies, Rift Valley fever, African swine fever, pollution management, and combating antimicrobial resistance, so the emergence of microbes that are resistant to antibiotic therapy. And we'll be considering this in its round over the course of the next hour or so. And I don't want to take up any more of your time outside of just providing that definition for you that hopefully sets the stage for what it is that we're going to be considering. And with no further ado, I'm going to welcome our first panelist to provide us a perspective on the biggest challenges ahead, the opportunities that are there, and then their vision for how One Health can be brought to bear to grapple with the challenges that we face and capture those opportunities. So our first speaker this afternoon is going to be Michelle Anholt. Michelle is a senior specialist in One Health at the One Health unit at University of Calgary. And with that, I'm going to turn things over to Michelle. Michelle, the floor is yours.
Thank you so much, Malcolm, and thank you to the CSPC for this invitation. I'm very happy to be here. So if we could put on the screen and show my first slide. Next slide, please. So this piece of art is from environmentalgraffiti.org, and it's called Rethinking the Relationship Between the Economy, Society, and the Environment. And the artist's name is Alyssa Singer, and she takes climate data and graphs and images to create a piece that allows the underlying science to seep through. And she displays her art with the climate data source to explain the significance. And so she uses these bold colors and the source information to draw people in and to help them become more engaged in the underlying message. And this particular piece of art draws from the concept of strong sustainability as described by the authors in the book, The Green Swan, Central Banking and Financial Stability in the Age of Climate Change, which is written by Patrick Bolton and others from the Banque de France. And the authors describe strong sustainability as the preservation of the integrity of all the ecological systems so that they're able to recover from disturbances and to reestablish stability, diversity, and resilience. And there's a couple things about this art that's helpful for me to describe what I think are our biggest challenges. One, like the artist, I'm completely at a loss as to why the general public isn't more alarmed about the compelling data around climate change or other problems, that's as an example, and its impact on our planet. This was her inspiration to try and get people to pay attention. And so policy discussions and stuff are my inspiration to try to get people to pay attention. Two, that we need system-wide global changes to our economy, politics, technology, and so on, because we can see that the profit-based approach to natural resources is failing, and it's impacting the health of people and certain groups of people, the social economically disadvantaged being far greater impacted than the wealthy, the health of animals, and the health of our environment. So something's fundamentally broken about our relationship with the natural world, and we need to bring our economic systems around to consider Earth's sustainability limits and find a more system-resilient approach. And three, the biggest challenges of our time, whether it be climate change or pandemics or biodiversity loss, antimicrobial resistance, and so on, they're all interconnected in that they're all man-made, and they're driven by the profit basis of our economy. And so from this, I have a series of interconnected questions, and how can we start to address those, and what role can One Health play in those? And it's how do we build or restore our relationships and understand that we have responsibilities to one another and the natural world? And how can we begin to explore the many possible forms that those responsibilities take, and with the end goal of resilience for a more resilient future? And how can we respectfully live with the land and with one another to develop a more just and reciprocal relationship? And I like how our Indigenous neighbors describe this as, what kind of ancestor do you want to be? So how can we position, promote One Health and the One Health approach that we can find it useful for finding answers to these questions? So those were my biggest challenges. If you want to move to the next slide, please. So for the opportunities, I think the Alberta One Health AMR Framework for Action is a success story. So the vision of this framework is a future in which Alberta employs its collective resources to prevent and contain the threat of antimicrobial resistance. It's a collaboration of Alberta's Ministries of Health, Agriculture and Forestry, and Rural Economic Development, Environment and Parks. And One Health at U Calgary has the role of project management and coordinates the engagement with partners and stakeholders. And we also have a federal liaison who engages with the key groups so that we have communication between federal and provincial AMR activities. We're about to enter phase 3 of this plan. The first phase was with stakeholders across all sectors to develop 15 areas for action, distributed under the 3 pillars and cross-cutting themes you see here. The second phase was to validate these priority areas and to develop a modified Delphi, and with a modified Delphi process and a cross-sectoral group of stakeholders, identify 3 priorities of action. And now we're entering phase 3, which is under the stewardship pillar, to identify and develop strategies for implementation of existing relevant local, national, and/or international antimicrobial stewardship guidelines for both human and animal health sectors. Under the surveillance pillar, there's 2: harmonize existing AMR, AMU surveillance data and programs to create an AMR, a One Health AMR, AMU surveillance system across human and animal systems, and such that it'll align with our national surveillance efforts. And develop a province-wide initiative for environmental surveillance of antimicrobials and AMR in sources such as water and wastewater and soil. So the success is that we've broken down silos within the Alberta government. In fact, in the first iteration of this, health didn't see any reason to include environment. In the second iteration, they were willing to include environment, but they didn't know anyone's name there. They didn't know who we should contact. So now we've developed some relationships. The meetings are collegial and productive, and as Malcolm said, relationships are so important here. So we have a plan for action and a strategy for measuring the impacts in the future. Next slide, please. This is hard, a vision for the future. I'm about to become a grandma and I'm worried. So I guess this quote I found useful is that with so many challenges that it'll be an impetus for change, and that One Health approach will be helpful. Remembering that One Health is not one thing, context matters, and how it's being applied will change depending upon the problem and the sector and disciplines involved. But we always need to involve members of impacted communities and consider the natural limits and respecting those natural limits. And with that, I think there is hope for change. And the CSPC and meetings like this are a step towards that. Thank you very much.
Thank you so much, Michelle. What a great introduction to the topic, and a great way of considering things in the round. And I might also add, a wonderful job of keeping within the 7-minute time limit for each of our speakers. Really appreciate it. Michelle, obviously, we'll be coming back to you in the Q&A. And colleagues online, in terms of the Q&A, if you're wanting to ask questions at the end of today's session, we will have an open Q&A, and you can be populating the chat section right now, chat section, pardon me, with your questions for panelists that we'll address at the end of today's panel session. Thanks again, Michelle. I'm going to turn things over then to a University of Guelph colleague next. And that's Jane Parmley. Jane's an associate professor in the Department of Population Medicine at the University of Guelph. Jane, over to you.
Thanks, Malcolm. And I will get started. Perfect. Awesome. So as both Malcolm and Michelle identified, over the past 20 years, global health challenges have become both more apparent and more urgent. SARS, monkeypox, COVID-19, antimicrobial resistance, climate change, biodiversity loss, growing inequities, I could go on. Each of these have their own significant impacts on animals, including humans, ecosystems, and society. But when they occur together, our collective ability to cope is compromised. The compounded nature of health threats today demand more time and resources than currently exist in our health and related systems. We simply don't have the human or financial resources to address each of these challenges individually. And as a result, many government and non-governmental agencies are having to grapple with multiple threats at the same time, which is forcing them to trade off things as basic as food security and nutrition, or employment and environmental protection. But the multiple health threats we are facing today are not independent of each other, and Michelle alluded to this as well. There are shared root causes that connect and drive many of the challenges: poverty, hunger, climate change, inequities, to name just a few. We recently did some work on antimicrobial resistance and asked experts from different disciplines to describe how the world needed to be different if some predetermined actions to reduce antimicrobial resistance and its health impacts were to be successful. The actions explored were taxation of antimicrobials at the point of sale and its health and improved biosecurity. Regardless of which action was taken, participants felt that success could not be realized without first addressing the Sustainable Development Goals. Until people around the world have access to basic hygiene and sanitation, food, and education, our efforts to reduce antimicrobial use and resistance are unlikely to be effective and sustainable long-term. To get ahead of the social and environmental changes that we are already experiencing and that are expected to get worse in the future, new partnerships, tools, and approaches are desperately needed. We need to do better and inspire positive change. And in my thinking about One Health since joining the University of Guelph, this is a core element of a One Health approach. First, One Health to me is really about health, not disease. It's about recognizing the interdependencies between the health of humans, animals, plants, and ecosystems. And it's about this idea of doing better so that all species, places, and generations can achieve their full health potential. Our current approach to problems is how we arrived where we are today. We need a different, perhaps kinder approach to respond to today's challenges and get us where we want to be tomorrow. Next slide, please. The need for a different approach, I believe, is creating new opportunities to rethink, maybe back one slide. Sorry. To rethink leadership and how decisions are made, especially how trade-offs are recognized and handled in decision-making. As we strive to cope with simultaneous pressures, particularly responding to immediate crises, there will be people, animals, and places that benefit immediately and others who may be harmed, at least in the short term. New practices and systems are needed to recognize when these trade-offs happen, who or what is, winning or losing now, and what the consequences of some of those decisions could be in the future. Whatever the approach, the trade-offs need to be confronted before irreversible social or ecosystem damage can occur. And to do better and support collaboration across sectors, we need spaces, both real and probably virtual ones now, and occasions to bring different voices together and learn from each other, to build trust and foster respect. This is easier to do when political will and public pressure exist, and when there is a common understanding of the problem. And I recognize this is a bit of a chicken and egg situation. We need a shared understanding to come together, but often need to come together first to recognize and develop that shared understanding, trust, and respect. I see this as an opportunity to develop and try new tools and approaches, to carry out research to better understand what works or doesn't work, who does it work for and who doesn't it work for, and in which contexts or settings does it work. We need evidence that collaboration and partnership contribute to better decisions and health outcomes. And I think this will require new ways of assessing value and measuring success. And last slide. Perfect, thanks. My vision of the future is one of equity and reciprocity, where people, animals, and ecosystems are able to cope with unprecedented changes today without compromising their abilities to respond in the future. Equity is not just about people, but to me also spans multiple species and multiple generations. Empowering people to protect their own health, the health of other people and animals, all while protecting the environment, will require new policies and practices to improve health, equity, and sustainability, all at the same time. We need to better recognize and address how health issues and our responses to those health challenges affect different populations, human and non-human, communities and ecosystems differently. Confronting the trade-offs will help ensure that health opportunities exist today and in the future. While there will be trade-offs, by working together, I believe that the negative impacts of decisions can be balanced out and borne by different groups and places at different times. For me, this is at the core of reciprocal health, which occurs when we take care of each other, our neighbors, and the places we live in to help reduce vulnerability and promote resilience. It doesn't mean that everyone or everything needs to be healthy and resilient all of the time. Reciprocity involves both giving and receiving, and both of these acts require practice to be done well. Around the world, the success of health promotion initiatives, such as access to clean and safe water, have been shown to be efficient and effective at responding to diseases and other health threats, or more effective and efficient, whereas responding to diseases and other health threats, once they emerge, is more difficult and more costly. By switching our attention away from controlling and preventing specific, already present diseases and other health threats to how we can improve health overall, has the potential to benefit all species and the ecosystems that sustain us. And I will leave it there.
Thanks so much, Jane, for both sharing with us the challenges, the opportunities, and a wonderful vision for the future. Looking forward to connecting with you back in the open panel session at the end. Thanks for doing such a great job at setting the stage. And also, as I said previously, with keeping to the time limit today. That was absolutely wonderful. Our next speaker in the order today will be Hélène Carabin. Hélène is from the University de Montréal, where she is a Canada Research Chair in Epidemiology and One Health. And amongst her other accolades, I think really importantly, Hélène is also co-director of the Global One Health Network. And with that, I'm going to turn things over to Hélène.
Merci. Could we show the slides? Okay, thank you. So I fully agree with what Michelle and Jane have said before me. I think we're all completely on the same page. What I'm going to talk about a bit more is one of the biggest challenges of One Health is how to operationalize it. The idea is neat. Most of the people I've spoken to have really think that it could be great. But the next question is, yeah, but how? And how do you do it in real life? So to me, one of the challenges are those we found in the scoping review we recently published, where we identify both barriers, and often they come with facilitators if you find a solution to them, to implementing One Health in large-scale studies all across the world. So one of the first thing that really is a huge barrier is having resources and infrastructures to cover health issues at the junction of humans, animals, and the environment. Another part that's really difficult is to make sure that people who are not used to working together, that have been educated to function in silos in their own discipline, to coordinate actions in order to try and maximize the health at the interface between human, animals, and their environment. And that requires trust. And Jane mentioned it, but this is really a key factor in One Health, is that all those actors that have never worked together, have never really thought of one another, start trusting what the other says. It also requires that the community participates in these initiatives and feel empowered by getting involved and making things better across all different species. And that needs to be acceptable socially as well. We need to make sure that whatever we try to implement in terms of a One Health intervention or a One Health program, it's sustainable. It's not something so expensive that it's not going to last. It also needs to become a priority for the politicians across all the disciplines, and this is extremely difficult. But one thing that can help us is perhaps make sure that there's an awareness about this approach. And in order to do this, make sure there's training available. And at the moment, there's not a whole lot of this, so it is a big barrier. And another barrier is most people at the moment do not understand what a One Health system thinking means. This means of thinking of problems and their solution, seeing all the different disciplines and all the different systems that can interact and what one another can bring to the solution. Next slide, please. Next slide. Yeah, okay, good. Whoop. All right, so in terms of opportunities, I think that now is the moment. Following this pandemic, there has never been so much movement in terms of global governance and also local governance and national governance. In November 2021, the WHO, FAO, WOA, World Health Organization for Animal Health, as well as UNEP, created the One Health high-level expert committee on to come up with suggestions and solutions to implement One Health. And one of the first things they did was to propose a definition. Because people had been arguing for years about a definition of One Health. We now have one, and it's adopted by all these international institutions as well as globally. The G20 even had a meeting around the same time where the different ministries of health agreed that One Health was one of the solutions to prevent the next pandemic. We were asked as well, the Global One Health Network, to come up with a policy brief on what One Health could bring to a potential pandemic treaty across the world to not only respond to the current pandemic, but to prevent the next ones. Nationally, at the Canadian level, the Canadian Royal Society came up also with a policy brief, to propose avenues to strengthen One Health for potential upcoming emerging zoonoses. Next slide, and I'm going to have you flip between the slides one after the other. So at the moment, our system is very much silos, like these pillars. You might have health in red, human health in red, animal health in yellow, and then in green you have social environment and physical environment, like environment, weather, climate, etc. Next slide, then you're going to flip through them. What I can see, is we need to deconstruct these pillars, next slide, but use what they're made of to build the One Health. So take into consideration all the knowledge from all these different disciplines, but put them together. Next slide, please. And create or think about creating infrastructure, such as a ministry or a secretary of One Health, have One Health education programs, One Health surveillance system fully integrated. Why not a Canadian Institute of One Health, so that we can do research at the interface between all these different disciplines? And most importantly, have people start having a shared vision, a common goal, and truly trust one another. Thank you.
That was excellent, Helen. Thank you ever so much for sharing your thoughts today. Merci beaucoup. In particular, a very bold vision for the future, and looking forward to coming back and discussing that in the panel session at the end, the open panel. And just a reminder to our audience that in the chat section of today's meeting, you are welcome to populate that. And I see there are questions already, with questions for the Q&A session. That takes us to our next speaker this afternoon, and that's Jagvinder Danda. Jag, great to have you with us this afternoon. Jag is the Executive Director of Animal Health Science at the Canadian Food Inspection Agency. Over to you, Jag.
All right, thanks, Malcolm, and happy to be here. Thanks for the invitation. I just want to set some backdrop to my presentation, is that the mandate of our agency, Canadian Food Inspection Agency, is pretty much relevant to One Health. We are responsible for food safety, plant and animal health, and thereby we support our market access and trade. But whenever we conducted our business, like till now, we are 25 years in the making, the One Health, although we use the concepts, but we never use it in a conscious or like knowing way. As my colleagues and especially Alain mentioned, that the time is here and now that we should start tying these pieces together. The recent pandemic, and as well as you might have heard and read or listened on the news, that there is an unprecedented outbreak of highly pathogenic avian influenza across the country. And also coupled with this, there is a real threat to North America and Canada, is that there could be an introduction of African swine fever into the country. And these all things which are happening right now gives the agency a real unique opportunity to start piecing these One Health concept together so that we can respond to these threats. Let's go to the slide, please. I don't see my presentation loaded in here. To the next one. So talk about challenges. Agree with my colleagues. Some of them, they are pretty common theme. A cultural shift is required for proactiveness to become the norm, meaning that we need to put more efforts and allocate resources on preparedness rather than being reactive to crises. For example, in the past, whenever we had avian influenza outbreak in the country, they were most of the time they were localized and were over in few months. This time around it's different because it's across the country and we are almost a year into this. So we pretty quickly realized that if we keep using the same old strategy, we will be really into this and drain out our resources very quickly. So we put in a lot of effort into advanced planning using science and risk angle to influence the decision making, not for just this fall, but also for the coming spring. As you know, that when the wild birds would start migrating back into Canada, they will bring this virus from the south. And obviously, working for a government organization, the legal frameworks, they kind of affect our front and center. For example, for avian influenza, our colleagues in Environment and Climate Change Canada, they're responsible for the wildlife side of things. The CFIA is responsible for the disease control in the poultry and domestic sector. Whereas public health authorities, they are prioritizing the zoonotic potential of the disease in human beings, and rightly so. The legislation, the privacy legislations, they also make the information sharing very challenging. We experienced during this current outbreak of avian influenza that we were unable to share information on the infected premises with the provincial health partners in some of the provinces due to legislative issues. This can block the public health information from reaching where it is required. And definitely the governance framework, which is the kind of the center of this everything. Sometimes One Health issues, they require timely assessment, but they do not fall into one department or agency's mandate. and can compete with other priorities. In many cases, there is quite a bit of shortage of highly qualified experts. We have been hearing veterinarians issues like there's a big shortage into Canada and across the world. Adding One Health activities to an already full plate requires a very effective prioritization to occur. As we know that we want to do any cross-sectoral collaborations, we need to step out of our regulatory or legislative boxes. Otherwise, really difficult to get buy-in. Go to the next slide, please. And along with the challenges, definitely there are opportunities, and some of them already highlighted that because of this, everything what's happening around us, the climate change, the pandemic, there is a renewed attention on importance of One Health. And definitely that should prompt all the stakeholders to share information, knowledge, and resources so that we can reduce the duplication of efforts and improve our decision making. A good example of here is that we have emergency response structures across the country to respond to avian influenza nationally as well. And we implemented a liaison role from agriculture, from public health, environment, and also included indigenous and industry stakeholders to share information and common messaging. This definitely has added depth to CFI's response, especially if in the situations where the disease outbreak occurred in outside of the organized poultry sector, for example, in wildlife rehab center, zoos, and also for the hunters who will be handling infected carcasses. Also, including indigenous communities in the mix, where they were implicated because they were in the disease control zones. Increased awareness of One Health definitely will improve our ability to adapt and create innovative solutions. An example, in almost 10 years ago, we created a platform which is called Community of Emerging and Zoonotic Diseases. It's a virtual network of federal, provincial, municipal, and industry and academia, which really helps us to do information mining and produce some business intelligence on the zoonotic and emerging zoonotic diseases. Definitely, another opportunity which we can talk about is that leveraging strength from individual partners, which can really enhance the, as I already mentioned, decision making. A few years ago, we created African Swine Fever Executive Management Board that brings together federal, provincial, and territorial and industry partners to talk about and also implement a pan-Canadian action plan for African swine prevention into Canada. This approach of bringing all stakeholders together at one decision-making table is very unique and have never been tried before for animal health disease efforts in Canada. As Ellen already mentioned, the one way to promote One Health approach is through education and training. If we can develop students who understand the connection between human, animals, and ecosystem, definitely will be better prepared to solve and prevent global health challenges. And already mentioned, I'm aware of Université de Montréal, University of Guelph, and Saskatchewan, they are investing in this. And there lies a great opportunity through summer placements or core programs to further build their education knowledge with some concrete projects before they join our workforce. And definitely how we can strengthen our regulatory actions in the last. By considering different viewpoints, the diverse viewpoints. An example of this during this avian influenza outbreak, there was a case in a petting zoo in Atlantic in late last year, where the input from public health was very crucial to define our response actions. As in addition to poultry, there were pigs that were exposed to this virus. As you know, that they can act as a mixing vessel for influenza viruses. Let's go to the last slide, please. For my vision, it's pretty similar to what Elaine mentioned. The next slide, please. I want to propose a pan-Canadian health strategy, especially to address this issue, which will involve collaboration across sectors which are responsible for human health, animal health, both domestic and wildlife, and the environment, as well as other partners. Other couple of points there are related to this aspect. In the agency, we are trying to build a small framework at an organizational level. Because while we talk about the national framework to be set up, we cannot wait things to put into action. So that's why we started a process to create a One Health framework that will consist of focal points from each branch and business line within the agency. This will provide a central platform for guidance and as well as build capacity within and outside. We already started to socialize One Health concept to raise awareness among our staff, and we are planning to train some experts in this approach so that they can become our stewards. The data is front and center of this overall strategy. We need to invest in creating, exchanging, and analyzing data to produce business intelligence. We all know that the Government of Canada is moving forward with the pan-Canadian health data strategy to improve the data management on the health sector. I see there is an opportunity for all of us to work together and leverage this. And last but not least, I would say that to support Canada's commitment, it is very important to understand and integrate Indigenous knowledge and utilize a diversity lens to analyze all data to better understand the impact of certain initiatives, policies, and services on these groups. And thank you, Malcolm.
Thank you very much, Jay. A great overview again of the challenges, the opportunities, and I like the congruence between your grand vision for the future and that which Helen shared with us, and looking forward to your deeper perspectives on that as we go to the panel discussion. Thanks very much, Jay. That takes us to our last panel speaker this afternoon, and that's Dr. Aaron J. Banerjee, who is a principal investigator in the Laboratory of Zoonotic Viruses and Comparative Immunology at the Vaccine and Infectious Disease Organization at University of Saskatchewan. Aaron J. holds a multitude of adjunct appointments, crucially one, of course, at University of Saskatchewan, where he is the co-lead for One Health. Aaron J., over to you.
Thank you, Dr. Campbell. And thank you, CSPC as well, and the University of Guelph for giving us this opportunity to talk about One Health. It couldn't be more timely. And perhaps my talk, if I could have my slides up, please. My talk would be more of an advocacy talk, following up on my colleague, Dr. Carabin's presentation. So, One Health is extremely complex. And I'm a virologist by training, so I'm going to take a virology lens on this and acknowledging that every discipline impacts virology as well. And hopefully you'll appreciate that connection by the time I'm done. So what I'm showing you here is how we as researchers in Canada who are attempting to do One Health have to seek funding for the science. So in my lab, we look at zoonotic viruses, including coronaviruses. We look at viruses that have civilization devastating potential. So we're looking at viruses, 70% of these viruses come from animals, and we know that we need to investigate and develop vaccines and therapeutics against these viruses. Now, if you look at where we have to go for the money to do our science, for animal science, we've got specific disciplines where we have to go seek funding to do our science on how these viruses impact their animal hosts. And when these viruses make a jump into humans, suddenly we are now having to go somewhere else to seek funding to do science to understand how these viruses impact humans. While One Health is this fantastic concept, as my colleague Dr. Campbell alluded to, is looking at planetary health, including human health, environment health, and animal health. But how do researchers go about doing it in a holistic approach? How do I study something that falls between the mandates of different organizations? So this, to me, is the biggest challenge. One Health needs to be seamless. It needs to be interdisciplinary, and it needs to be collaborative. And science needs money. And the money needs to come from an agency that is willing to fund science that connects the three different pillars, as my colleague, Dr. Carabin, alluded to. Next slide, please. However, while that's a challenge, we have a fantastic opportunity. We've had SARS outbreak in the past. We've had Middle East respiratory syndrome, coronavirus outbreaks. Now there are animal health outbreaks as well, African swine fever, for example, and avian flu. But we've never had a pandemic of this proportion in our livelihood, in our living time. So we've now got an opportunity in Canada to be world-class researchers, or world-class, a country that commits to One Health science, a country that's going to take this step to not just protect Canadians, but the global citizens from the next pandemic causing pathogen. And again, in the last slide, you'll see how all of this connects with what my colleagues have alluded to. So what I'm hoping, and the opportunity that I dream of when I'm having a cup of coffee, is thinking about an inclusive One Health funding agency. This is something my colleagues have spoken about, and not just tri-agency, but also provincial funding, national funding, philanthropists, for example. One Health, everybody's talking One Health, and this is our time to go seek funding for perhaps a pan-Canadian network. There are excellent One Health networks in the US, there are One Health networks in Europe. We've got fantastic colleagues doing One Health related science or One Health themed science in Canada. Why can't we come together to build a network in Canada that's funded by the government, and not just during a pandemic, so not reactive, but proactively funded so we can prevent COVID 2025 or COVID 2050. So we don't need that. And we've got the expertise in Canada. So really it's about interdisciplinary collaborations and advocacy. We've had colleagues like Dr. Carabin who spent decades doing One Health science in Canada, and we all need to team up and perhaps advocate for a One Health themed network. Next slide, please. So this is a vision that I had. We're really like an umbrella with different themes, and planet Earth is what we are trying to protect. So if you look at all of these themes, climate change, there's data, there's rigorous scientific data showing climate change has a direct impact on how viruses emerge from wildlife animals. There's data showing that COVID-19 has a huge impact on antimicrobial resistance. So these problems are not in their own silos. They're interconnected problems, but we don't have an interconnected platform to deal with these problems holistically. And if we do start identifying these problems as connected, we'll have endless opportunities for inter and multidisciplinary collaborations. And we'll also have opportunities for multi-partner funding as well. So this is perhaps my very ambitious vision for a united research field in Canada, where we can totally impact the health of Canadians and the global health as well. I'll stop with that. Thank you.
Thanks so much, Aaron J. What a great vision to finish on, one that really capitalizes on this really important moment in time that we find ourselves in, combined with this incredible expertise that we have in Canada to seize the opportunity to really position ourselves as leaders in this space and do something that, as you say, prevents COVID 2025 or COVID 2050. Let's not have another pandemic. What a great note to finish on in terms of our panel discussions. I'm going to ask if all of the panelists could be highlighted, please, and want to thank you all, first of all, for great presentations, and for all of you impressively as a bunch of academics to keeping to the prescribed time limit. Was just maybe a sign of the apocalypse. It was pretty amazing how well everybody did. So thank you ever so much. And so what I want to do is just a quick roundtable. We have 2 questions for the panelists today before I open the Q&A. And just a reminder to audience members, please use the chat to post your questions for the Q&A. We will also allow audience members to ask questions by raising their hands. But hopefully we'll have good questions in the chat. And I see that there are already some that are there. With that, on the back of the incredible visions that each of you shared, some nice, as I said, congruence between some of those visions, and indeed arguably between all of them. What we've asked you guys to do is to give some consideration to what is the single largest hurdle that needs to be overcome in order to achieve your vision. And I'm going to go back through the batting order here again, and I'll kick things off with Michelle. What is the single largest challenge to achieving your vision, Michelle?
I think the biggest challenge is that change is hard. And people are wired to respond to immediate threats. And for many people, that immediate threat is losing a job or not even being able to feed your family this week. So responding to a threat that seems like it's in the future is going to impact populations maybe far away from you, can be hard to get people to respond to that. And it won't be easy. We're, especially us in comfortable Canada, we quite like our lifestyles. So we have to think about what we're willing to give up, and how we can move that needle. So I think that to me is the biggest challenge.
Excellent. And I like the fact that it's very tweetable. Change is hard. I think that's a really important consideration. Jane, I'm sure you agree with change being hard. What's the single largest hurdle that you see in being able to realize your vision?
I totally agree with Michelle that change is hard. And I think to be able to cope with change and the need to change, I think requires some time and space to consider it, and not endless time and space, but you can't just sort of enact a change and say, get over it, but have that dialogue, have that exchange of ideas, and enable people some time to express their concerns, to feel like not just feel like they've been heard, but to actually hear those concerns. And that's what I was trying to allude to, I think, with the trade-offs. Like, we need a way of recognizing those winners and losers in our decisions, and ways to support those who are not going to do as well with some of these actions that we're going to have to take.
Fantastic. Thanks, Jane. So what have I got so far? Change is hard, and make sure that we're talking to people and convening the right tables and providing supports for those that may not get the support that they need normally. Great points. Helen, over to you. You've given a lot of thought to this. What do you see as the biggest challenge in realizing your very bold vision?
Well, I do agree with Michelle and Jane that change is hard. And one of the things, and I'm going to cite here my colleague Katinka Debalog, that I've known for years, who worked more than 20 years at the FAO, really starting that whole One Health initiative from the get-go with rabies program and all of that. And what she always says is the key point, thus challenge, is building trust. And she always refers to that trust equation where trust depends on the numerator. I'm an epidemiologist, yeah, so I like formulas, which is credibility. You have to, believe what the others say. Reliability, when that person says it, they do it. Intimacy, which is harder to measure. These three things with one another. And most importantly, divided by self-interest. And as long as the different disciplines, the different health issues, environmental issues, and in the environment, I include social environment and society as well. As long as we only look at our own belly button of our own discipline, it won't work. So that shared vision is absolutely essential through trust.
That's awesome. Thanks, Helen. An equally bold ambition to go together with your bold vision, but something that does seem achievable. Jag, over to you. What do you see as the biggest hurdle to achieving the vision? One that in some ways, the way you articulated it, very similar to the vision that Helen shared.
Yeah, definitely. I think I agree with my colleagues. Change is hard, and we need time to put that change into practice. So. And that requires that cultural change, to break that siloed approach, like which Elaine also mentioned. And that really, if we stay in silos, that really hinders that cohesive leadership and the action and accountability which we are talking about. As you know, that all One Health issues, they cross jurisdictions. And sometimes the priorities, they do not always align. And there are select few people who really know what they are good at and they keep doing the same way, but they often fail to consider the other points of view. I think that's where the issue is, and that also stops the data flow, the information flow between groups. So that would be my biggest challenge in achieving the vision.
Conversations, breaking silos, change is difficult, getting trust. You guys, there seems to be a common theme here about convening and getting people comfortable. Aaron J., where are you going to take us in terms of what you see as being the biggest hurdle to realizing your vision?
I think for me, it's the model of how do you do all of this. I think, and Dr. Carabin alluded to this in her talk. Like, we all have excellent visions, but how do we implement this? So if I were CIHR or CFIA or FAC, and you come to me, what do you want me to do? So that's where I'm hoping I can sit down with some of my colleagues on this panel, and we can come up with a strategy that we can then push. That this is what we need, and this is how it's going to change the research landscape in Canada. And that's my vision and the challenge for myself, perhaps.
So what a great segue. I'm going to go reverse batting order because you provided such a great segue to our second question, Aaron J., which is,
oh no.
You've just mentioned a bunch of government organizations. What, here we are. We sit in the midst of effectively Treasury Board pre-budget submission season. What's your ask? What's your policy change that you want to see brought about that enables you to make that the step towards that vision? So I'm going to throw to you first, and then I'll go reverse batting order.
Oh no. Okay, so I think this is why I'd like to sit down with my colleagues and come up with this. And you're right. How do you come up with a number? Because people like numbers, and how do you put a number on it? But I am optimistic. There are lots of networks that are now being funded post COVID-19. So One Health could just be one another network that you fund, but you can't defund it. I think one of the biggest challenges we had when we were dealing with COVID-19 January of 2020 was lack of people trained to work with it. Same goes for One Health. We don't have trainees. We don't have the next generation of scientists who are trained to deal with these climate crisis, AMR crisis. So how do you bring about like degrees and master's degrees, PhDs, trained students who think One Health, who don't have to pivot during a pandemic, but they'll do it naturally and organically. So I think it's about capacity building in Canada and sustainable long-term ring-fenced funding as well.
Fantastic. And what a great year to be asking for. We're at the end of our 4-year stretch of increased funding for the tri-agency. So seeing even some targeted tri-agency funding in the area of One Health might be a good way to go. Of course, training lives in provinces, so we might have to have a provincial dimension to some of this, some of the policy asks here. But what great points. Jag, over to you. Breaking down silos or anything in that regard. What's a policy change that would help us break down those silos, help you achieve your vision?
Thanks, Malcolm. I think gone are the days when like you want to go solo and you want to showcase like you are on the top of this and this is your area, you get funds, and then suddenly, boom, you spring a surprise, I did this, A pandemic hasn't taught us, I think, that start to work together. I don't know what it will. So a policy framework which is provides the clear leadership, the accountability, and enhance and collaborative intelligence to bring the One Health activities from local level, organization level to a pan-Canadian level. I know it's a kind of a tough ask because sometimes people think that this is not going to happen. You're talking too much, but at the end of the day, I think we did realize that if we did reach out during this pandemic or even in our avian influenza experience, when we reached out, the results were really positive and people realized that this is the time to work together. So if you want to respond to these emerging threats or prepare for them, I think we need to break these barriers, the silos. The culture changes should be here and now. I think that is my one take.
Thanks so much, Jay. And such an important role for CFIA to play in the leadership there. And we've got former CFIA leader and now Health Canada leader, of course, Harpreet Kokar, who's a huge proponent of One Health. So maybe some of the thinking that you've got there will gain some traction in the offices where it matters. Helen, I know that you had on your slide Canadian One Health Institute or organization. What's the policy step that gets us towards that grand vision?
Yeah, that's difficult. But I think just in terms of policy, of thinking One Health, we should look at low and middle income countries. They are way more advanced than we are in terms of One Health. Several countries, for example, Rwanda, have ministries that are in charge of the One Health, one after the other, from one year to the other, making sure that this constantly gets done. Burkina Faso, and Jane would know about that, they have someone in charge of One Health surveillance, and they make sure that it is integrated. And I think perhaps it's because people are very conscious, still they're educated about these concepts because they live it every day. Jane was mentioning, Sustainable Development Goal, sanitation, water. They see this every day, and they see the issues, the challenges of not only nourishing themselves, but nourishing their animals and growing crop. You have it right in front of your eyes. So indeed, we need education. I agree with Erenji on that one. And I think all our universities here, represented here, we are all trying to build One Health programs, and we're actually working together at it. So I think I've got hope.
It's excellent, Helen, and really love your points, especially around when zoonotic disease and the impact that it has is visible for you as well as the livestock that you're caring for example, where those connections are so obvious. It's maybe more easy to put policy in place, maybe in more highly urbanized countries like Canada, a little bit more difficult. Jane, I know you've had specific experience there. And in fact, it was wonderful this year at the University of Guelph One Health Symposium. You'd actually had a fantastic speaker from Rwanda. I wonder if that's shaped some of your thinking. What's the policy change you'd like to see happen that would help you get to your vision?
Yeah, no, it's a great question. And I'm not sure I have a terrific answer. I was thinking very much along the same lines as Hélène, and I was going to mention Rwanda as well, and just some of the lessons that we can learn. And I think in Canada, we have a lot to potentially, that we can be perceived as losing, right? Like we're living a life that at the expense of other parts of the world. And so how do we figure out how to let go of some of our wealth? Maybe for the betterment of all. And I want to refer to the Royal Society of Canada One Health policy that Hélène mentioned earlier. And in that, we have a few ideas to put forward. One is to establish some sort of One Health Council that is not sitting within the Ministry of Health or the Ministry of Agriculture or the Ministry of Environment, but something that supersedes all of those. And so it's not going through one particular minister, but a way of making sure that all of those ministries are working together towards a common goal. And I think part of that, establishing that council, would be really to develop a One Health action plan. What does it look like? How are we going to do that? Erenji has talked a lot about that I think we all agree about the One Health concept, that everything is interconnected and interdependent, but what are we going to do about it? And how are we going to make those shifts? And that One Health action plan might lay out a roadmap to get us there. And I think several of my colleagues on the panel have also talked about the need for resources and funding, whether that's for educational programs, whether that's for research projects, whether that's for community action. We need a mechanism to support those initiatives. And whether that's a One Health Institute, whether that's a One Health Center of Excellence, whatever we want to call it, I think we need those things. And there's more than that sort of described in that policy brief, but I think I'll leave it there.
Oh, Jane, thanks. What a great response. And thanks so much for highlighting that Royal Society policy brief. I love the idea of convening a table that actually comes up with a cogent plan, a strategy. Effectively, you're arguing for a Naylor report for One Health, a roadmap for the road ahead. Michelle, we've had you parked for a while. Finally, back to the beginning of the batting order, so to speak. What do you see? Last word to you on policy change that would help you realize your vision.
So I'm going to go a little bit of a different direction, but Jane kind of twigged what I wanted to say was about how do we let go of some of our wealth. And so my idea sort of takes us to more accountability and responsibility, words that we've already heard today, and take us to a personal level. So I think that one of the first steps we need to realigning our economy with what the environment can cope with, and also realigning where the wealth is sitting, is that that the price of all the stuff that we want, and we want lots of stuff, that the price of those goods reflects the real cost. So that instead of having the price of your plastic widget just being the cost of making the plastic, the labor, and the materials, it also needs to include the cost of the environmental damage made while making it, and the waste it represents at the end of its life, which is likely a very short life. So we can no longer walk away from our responsibility of the stuff we use, because because our stuff impacts those low and middle income countries, and it impacts the environment in huge ways, as well as biodiversity loss and all that sorts of stuff. I don't know how we do this, but I think a policy change where the price of our stuff reflects the true cost.
Excellent. Thanks so much, Michelle. You're speaking an awful lot like a soon-to-be grandmother there, and I say that as a two-time grandfather on this side, about being a good ancestor, effectively. What is it you're doing in terms of the legacy that you're leaving behind? How do you put policy in place that ensures that you get the impact that you desire? And what you described is something that extends obviously beyond One Health to many other facets of the way in which we live our lives. So thanks so much for that, Michelle. Absolutely excellent. There are some great questions in the chat, and I will point out to our audience members that Aaron J has done us the great service of providing the link to the One Health Royal Society policy brief. Thanks for doing that, Aaron J. And speaking of Aaron J, I see that he's just got 5 minutes left before he's got to jump to his next commitment. So I do want to get to some of the questions. I'm going to start with those that look a little bit more generic, and I'm going to try to generify some of the questions that have been posed at specific speakers. The first one is that I'm going to jump on is one from Nathalie Granvaux. And Nathalie has effectively suggested, is there a possibility here for doing a CIHR style network or a tri-agency partnership network to really get things off the ground? Is that where we could be creating the fertile ground, if you will, for doing some of the things that Jane was talking about, like creating a broader strategy? I'm actually going to flip this to Aaron J first, because it's you're going to have to jump soon, Aaron J. But it also fits very much with what you were suggesting.
Yeah, thanks for the question, Dr. Granvaux. We've had this chat with Dr. Mike Strong as well from CIHR, and I'm hoping that with Dr. Dunda on the call, CFIA and CIHR can perhaps have a chat as well. And partnering with could be NSERC, could be CIHR, but I think it's very good to see that decision makers and regulators and funding agencies are chatting about One Health, and we'll advocate as much as we can. But it'll be good to see a change coming from the other side, and perhaps you can invite us for advocacy seminars, even at CFIA. We'd be happy to come down and tell you how this works out for Canada and how this works out for researchers, students, and the government. Well, I'll just leave with that. I don't have a specific model in my mind, but I think this is a good first step, having these discussions.
Excellent. Aaron J, yes, you are going to have to jump in just 3 minutes. I'm going to give you this opportunity as well. And just a reminder to the rest of our speakers that I'll be asking you in 17 minutes. What's your tweetable take-home message from what you've talked about today yourself and what your fellow panelists have shared?
I think I think along with vaccines, One Health is what is going to future-proof Canada and the world from emerging problems. I'd call it problems. It's not necessarily zoonotic diseases, but emerging problems.
Excellent. Want to future-proof our country? Put One Health first. Love it.
Right.
That's awesome.
And thank you for having me, Malcolm and Guelph and CSPC. It's lovely to see everybody.
Truly wonderful to have you with us, Aaron J. The rest of the panelists are going to hang on, so don't leave us, audience members, but just wanted to give Aaron J. An opportunity to make his jump to his next meeting. Helena, I'm going to jump to you actually with regards to the CIHR network. You've been playing in this space for a long time. I suspect that such an idea has been floated before. Where have the challenges been in realizing that?
Well, I would
If
say
you want to
that,
talk about without incriminating anyone.
Oh, no, but the issue currently with the way it's currently done, the networks are funded for 4 years and then they're gone. A network doesn't take 4 years to build. So for example, our global One Health network for the governance of infectious disease and AMR, which by the way, was funded before the pandemic in 2019. There's no announcement for renewal. So, you know, how do you continue? How do you get these things going? Well, we can try and continue getting it going by being volunteers, but you know, staff are not gonna work for free. So there needs to be continuity for these networks. And if we want to build something like a joint action plan, there needs to be continuity, like what Jane was saying. So the FAO, WHO, UNEP, and WOW just published their joint action plan. This is fantastic, but honestly, it took years to think about it. I was saying Katinka de Balog has been thinking about that for 20 years. And building these networks, this trust as well amongst people, you can't do that quickly. So continuity is important, and it should not only be CIHR. It has to be CIHR, INSERC, and SHIRC. Because ultimately, and I agree with what Michelle said, ultimately, human beings are responsible of what we're living right now. It's their behaviors. So SHIRC is absolutely essential in all of this as well.
Absolutely excellent, Helen. Helen, I'm going to stick with you because actually in some ways, and I hope Elizabeth Rax, that your question has been addressed, because I think, you know, some of the questions that Elizabeth was asking was, you know, why don't we, you know, it's not as though we haven't been in an AIDS pandemic now for 40 years. It's absolutely incredible that we find ourselves in this situation, and yet we still haven't made any action. Helen, you came back to trust again there, and trust was such an important fundamental challenge that you mentioned in your particular segment. I'm going to ask the same question of everybody around building trust. Tim Zhu has asked specifically, how is it that we build that trust? So in addition to having networks that, you know, are longer than 3 or 4 years, where you establish continuity and relationship, what are the other fundamentals that we need to be building trust in One Health networks?
It's getting to know people. It's as simple as that. And honestly, the pandemic has made this really hard because most of our meetings have been online. You know, we've learned to work with this, but it's not the same as sitting down with someone with a beer and just talking to one another. And actually, we did a study in the context of GFIN to look at the response to a case of swine influenza in a human being in Alberta. And one of the reasons the response was so great is that there were some people in the different ministries and the different sectors that knew one another which made communication, the channels of communication, really easy. So it's getting to know one another. And this indeed you can do through networks, but you can do that through networks, and you could do that through education. That's going to take longer, but once we'll have our One Health programs, hopefully the idea is to get people from different disciplines to be trained in the core and talk together to find solution together to one single problem.
What a great point. And, you know, it's a distinct advantage that is available for the post-secondary education institutions that are sitting around the table today. My president just got back from Universities Canada meeting last week and was talking to your president, Hélène, on exactly this topic. And, you know, what a great common point for, you know, I'll use as a plant biologist, I'll bring a plant biology metaphor here. What a great opportunity for cross-pollination between institutions. Jag, I'm going to spin to you on this, though. You know, there's a lot on the education side of things where we've got great conversations occurring between Calgary, between Guelph, between UDM, between Saskatchewan. How does CFIA find itself in the mix so that you're drinking beers with people around the same tables? How do you guys break down the silos so that you are also integrated in part of this trust building exercise?
Yeah, really good discussion. Thanks to my colleagues and Dr. Campbell. Is, you know, I see that, like, you know, all across the globe, always when there is a crisis, that is the news, and people get attracted to that, and then that's where all the resources and efforts they go towards that. And as Ellen mentioned, like if we do not start investing in, you know, a long-term plan, like it cannot be, okay, this is the flavor of the day, we are in pandemic and let's get together and have a 2-year funding, and then we forget about it when everybody start walking around without their masks. So I think that culture change to invest in future and prevention and preparedness, that would take us where we want to go, and that would save us. And I think that starts with educating our younger generation in understanding when something, just like for our veterinarians, we have lots of veterinarians in CFIA, they do food safety, animal health, and there is a plant health. I don't think so they talk all the time when things they crisscross, what could this be, and is there interconnectedness? So if that sort of knowledge gap is reduced and that barrier, start thinking across the spectrum. And I think the universities are doing a great job slowly coming to the pace. And we've been having discussions across the board with various educational academic institutions to bring in those experts, say 1 year, first year, second year, and the graduates to work with us to understand. They can get firsthand knowledge and like how these crisscross things they happen. They can see real life examples. Lots of actually we got some resources across to work in avian influenza when they walk in, and then they see like there are so many things. There is wildlife, wild birds, and we've been seeing cases like in marine mammals. You know, this is, if we do not learn from this, that things are not in those boxes where everybody think or thought, I think we will miss this opportunity, and the educational institutions will play a key role in building those stewards for future. And organizations like ours and Public Health Agency, Health Canada, ACC, you know, there are so many organizations which can, I think, maybe stay in touch with this and see where the need is, and could you feed that need, and could you address that need? So that would be my response.
Thanks ever so much, Jag. And you're right. You know, if not at this moment, when? Let's make sure that we do have the channels of dialogue open, and what a great opportunity to create channels of dialogue by those trainees. I'm reminded of a conversation I had 7 years ago with then CFIA President Bruce Archibald, who reminded me that the largest single employer of veterinarians in this country is the Canadian Food Inspection Agency. And what a great opportunity then to create that sort of connectivity. Speaking of connectivity, Michelle, I want to swing to you because there were two questions right off the hop, one from Jason McAllister and another from Tom Finn that I think speak to the model effectively that you've established in Alberta. For example, the Alberta One Health AMR framework, where you have got people around the table, where you have open dialogue. Are there some important take-home messages that we can take from that could be translatable for what we may want to do on a national level?
I think so. So someone asked, yes, it was Jason who asked if it was Alberta specific, and absolutely not. It's not Alberta specific. What we're doing could be done in any province, although the stakeholders, and they included industry as well and researchers as well as government, they may choose different priorities. Ours were chosen based on what we thought were most important and also doable with the funds that we had. And I think that what was important here were the resources, is that they are paying One Health at U Calgary to manage this. And so we have dedicated staff who are making sure that we've identified the stakeholders, which is not always an easy task. Like, who in the swine industry needs to be at the table? And you get on the phone and you ask questions and you find that person who's willing to be at the table. And we make sure the meetings happen and then they happen on time, and then it continues to move forward. So this isn't something you can do off the side of your desk. It needs dedicated resources and people, to keep it moving forward. And as for the risk, that was the second question from Tom, I would say is politics, for sure, right now, because we have a new premier who's openly said that she's going to be replacing Dina Hinshaw, who is instrumental to this. Like, she's not on the day-to-day work, but she's part of the oversight committee, very collaborative, has worked really well. And so now we have a new premier with a different vision. And I don't want to get into a hair on fire rant about Alberta politics, but I could if you wanted me to. Anyway, so the contract signed, but whoever replaces Dina Hinshaw, if they want to go a completely different direction, we'll be going a different direction. And so we're kind of waiting.
This is the Canadian Science Policy Conference, and it points to the challenges that we have when policy is dictated by short-termism that can occur with regards to who our politicians are and the view that they have. Especially if they're, and it's not to cast a disparaging remark on populism, but, one of the features of populism is that you're addressing whatever the public will is of the day. And that may not give you the long-term strategic view that you need in order to address these grander challenges. I want to spend finally to Jane, because I've kept you parked for a while, Jane, and just Jay mentioned the role that universities can play as training platforms. You played an instrumental role in the One Health Institute at University of Guelph. What are your reflections on, as you've been working together with colleagues like Helen, like Michelle, like Aaron J. across the country, thinking about how we create the next generation of thought leaders in this space? What are the big take homes there that you'd share? And recognizing just got a couple minutes left, and I want to do one quick round table before we're done.
Yeah, and certainly there's been a lot of conversations, and I think a lot of the programs that we have both at the University of Guelph and at other campuses across Canada are new or still in development. And so figuring it's going to work, sharing ideas and experiences. And one of the things I just want to emphasize, so just this semester, University of Guelph launched the Bachelor of One Health program. And we spent a lot of time thinking about what the program needed to look like without thinking about what the degree was. Is it a BSc? Is it a BA? Is it a whatever? And it didn't fit any of our current models. And so we now have a Bachelor of One Health, and it really is emphasizing the need to work across different colleges, to have students interested in the arts as well as the sciences, to create, like Hélène said, that core of courses that allow them to come together, but they're able to go into other sort of areas of emphasis to really build their skill set. And I think in training them and graduate students as well, it's going to be about evaluation and what works in different contexts, what we can learn from each other. And so again, it's those conversations and ability to have some dialogue And I think the other one, just bringing it back to some of the need for ongoing support, is that a lot of these changes are not going to happen in a 4-year bachelor degree program that we evaluate once. It's going to take 10, 20, 30 years before we see that measured shift. And we need to figure out how to evaluate changes that are going to be a long time coming and not just throw them out because they haven't immediately had an impact. So I'm not sure, Malcolm, that addressed your question, but I'm super excited about the new One Health training programs across the country, and I think they offer a real bright spot in the future.
Well, and you guys are such energetic proponents of this. I have every confidence that they are going to be a success. Jane, it was a great answer. Quick roundtable by all of you. You already heard me ask Aaron J. the question. What's your tweetable take-home message for today? And I'll do things in our starting batting order. I'll kick things off with Michelle.
It's hard to pick one thing, but I would have to say One Health and our vision for the future is about relationships with each other and Earth.
Fantastic. Thanks, Michelle. Helen, over to you.
Listen to other points of view and have an open mind.
Fantastic. Sorry, Jane, I skipped you. Jane, over to you, Jane.
That's okay. We're all in the same vein. I was going to say take time and get to know other people.
Fantastic. Love it. Jag, last word to you.
I'll go a little bit not too philosophical, but I would say invest in prevention and preparedness so that our response can become much easier and we don't have to deal with it. So that would be my take-home message.
It's the outcome of what your 3 previous panelists said. Hopefully that's the deliverable that we get out of the trust that'll be built from the dialogues that are created, the thoughtful discussions. Speaking of thoughtful discussions, great job, panelists. Absolutely wonderful. I'm just going to give you a shout out in the order that I now see you on my screen. Jag Danda from CFIA. Great job today, Jag. Thanks so much for joining us. Jane Parmley, University of Guelph. Always wonderful to see you. Jane, we're here today across campus with each other. Michelle Anholt at University of Calgary. It was great to connect with you earlier in the year in Saskatoon, and seeing you online through this process has been fantastic. And finally, last but not least, truly a leader in the One Health space for decades, as we heard here in Canada, Hélène Carabin. Hélène, what an immense pleasure and privilege to have you as part of this panel. Thank you so much for joining us. Colleagues online, you heard a lot about One Health today. If you're a policymaker, be working together with our government to come up with the policies that are actually going to help us create the platform that's necessary to prevent COVID 2025 and any other disease that may be emerging before then. I really are relying on you and the great work that you do in the policymaking machinery. For those of you who are young people, and for me, that's anybody under the age of 50. I'll tell you that right now. Anybody who's a young person today who was inspired by this, make sure to capitalize on the emerging programs that are emerging across the country for training. You are going to be our future thought leaders. We're going to be relying on you to solution the challenges and realize the opportunities that One Health has. Finally, colleagues, I would encourage you to participate in CSPC in the coming weeks. Make sure to engage in online sessions or attend in person. And for those who are attending in person, look forward to seeing you in person. And make sure finally to fill in the poll about today's session. With that, I think I've covered all of my duties. It's been a real pleasure to be together with you. My name's Malcolm Campbell, Vice President, Research, University of Guelph. What a great pleasure to host this event today. Thank you, CSPC, for enabling us to do so. Cheers, everyone.